Hello. This is Dr. Ahmed Al-Magable. Welcome to OET Professor. Again, we are talking here about Part B. As we agreed in the first, from the first, that we will take the minimum score for each part. In Part B, the minimum score that you have to get is 4 out of 6, 4, 5, or 6 out of 6. The most important thing about Part B that you have to know that each question is a whole kingdom by itself. So you have to use all the skill for each one. Part B in listening and Part B in reading are considered to be easy, and you can get most of them, most of the question in those two parts. So. Now about Part B. What is the most important thing about Part B? Part B, you will be stunned from what you listen right now, but I have a rule for it. It's very important rule. Is open, close, open. What I mean by that? That in all subtests you should not close your eye. You should always keep your eyes open in Part A. In Part B, you should always keep your eyes closing. In Part C, you should always keep your eyes open. What, doctor? What you are saying? So you are saying that I have to close my eyes in B? I'm not saying that. I'm saying that while listening to the record, yes, you have to close your eyes completely, just like and you will find a dramatic and fascinating result with that. After he will read this first sentence, you hear consultant talking to a woman whose father has just been admitted to the hospital. He will give you 15 seconds to read the question. Concentrate to read the question. So you have to read the question thoroughly. What does she want to know about his condition? Then you go by skimming on A, B, and C. How serious it is, how much is the pain. Sometimes the answer is too long. You just read it by skimming. Okay. Once you hear beep sound, you have to go back and read the question and just close your eyes and repeat the question in your own language. Even if you are not Arabic, Pakistani, from where you are, just repeat it in your mind and concentrate with each sentence that they would say, because your answer, because as we all know, that understanding of the question is 2/3 from the answer. This is very important. What does she want to know about his condition? So I just keep it. What does she know about the condition? What is the most important thing that she wants to know about his condition? I just repeat it in my mind again and again. In the same time I'm listening to him. So this will give you a dramatic result. Okay, fascinating result. Sorry. So when you have to decide what is the answer, once the record is in and he's moving to 26. What, doctor? What you are saying? Yes, that's what I'm saying about. Because the answer, it may be in the beginning of the record, in the middle of the record, or in the end of the record. This is super important, and we will practice on it in the online live sessions, but this is very important. I will repeat it again, that the answers sometimes in the beginning of the record, in the middle of the record, or in the end of the record. So please concentrate with each sentence from the beginning to the end. Sometimes your mind just skip it when you find the answer while you are listening. Your mind just do not listen to the end of the record, which is very incorrect. Okay, which is very incorrect. So you just decide what is the answer when he moves to the when the record moves to the 26 to question number 26 and etc. You just have to use that again and again and again and practice on it. So please concentrate with him. I will start the record of part B.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a consultant talking to a woman whose father has just been admitted to hospital. Now read the question.
Okay, so read the question as we agreed. You read the question, skim the answer, read as much as you can from the answer, but it's okay that if you did not finish them, once you hear beep, you go back and read the question and just concentrate with him. So please now predict the answer. I will be silent until the end of the record.
So we've talked about the various things that might have caused your father to collapse. A lot of times we investigate multiple symptoms so as to rule out any life-threatening conditions.
So it could take some time to get to the bottom of the problem?
Possibly. In the meantime, he's quite stable now, and we're encouraged by the progress that he's making.
Well, I'm glad to hear that. But at least he's not in any great discomfort, is he?
According to the assessment at the bedside by his nurse, his pain is well controlled, and we'll try to keep his sedation at an adequate level until we're ready to begin treatment.
Question 26.
So, what is your prediction for that? How serious is it? Is that what is she asked about? How much the pain is causing, or how long before there will be diagnosis? If your answer is B, then it is the correct answer. And as I told you, sometimes they do not give you the same give you the same word. They give you a synonym. She asked about I just want to know that if he feel any discomfort. Okay, that's what alerted me. So please consider that. Okay, I will be now in question number 26. Please concentrate with him and just once you hear beep, read the question and understand the question thoroughly, what he's asking you, then you listen carefully.
Trainee nurse receiving feedback from her tutor about the ward round she's just completed. Now read the question.
How do you feel your ward round went with that patient?
Oh, I really should have told him what I was about to do, rather than just rolling up his sleeve to take his blood pressure.
Yeah, it would have been preferable, but at least you realise.
Thanks.
I think you did your observations really well, though. You checked the patient's details are correct, you put the date in, you timed it correctly, you observed that all your parameters are within normal range, and you did the respiratory rate while you were doing your manual pulse.
Yes, the pulse was quite strong and regular.
And you could have passed that on to reassure the patient too. But you look back at the previous observations, put your signature at the bottom. That's all good.
Thanks, okay.
Okay, so as I told you, the answer may be in the beginning, or in the middle, or in the end. This is in the very beginning. she told him that I should make him more informed. So the answer is B. You go back. Of course, in all the test, on all the material that I would give you, I will have all the script written down, so that you can, in the same once you have the audio, and at the same time you will have the script. This is super important. Now, 27, which will be the last one in this brief illustrating of part B. Please concentrate with him.
Question 27. You hear a hospital nurse briefing a colleague about a patient with chronic obstructive pulmonary disease, or COPD. Now read the question.
So, who's next?
The patient in bed 12, she had a fall at home about a month ago, but she's otherwise independent with her day-to-day activities. Her fall's risk is high given her recent history. She's been assessed by the physio, and she's on a rollator frame to ambulate. Her skin integrity is intact, and she's responded well to all treatment.
Good.
She's on a normal diet. The observations were last done at 6 a.m., and they were stable. Her medications are IV tazocin due at 2 p.m. and prednisone next due at 8 a.m. tomorrow.
Okay.
You need to check with the doctors today whether she'll continue with the IV antibiotics and whether the cannula can be removed. At this stage, they're aiming for discharge in a couple of days' time, pending discharge from the physio and also ceasing IV antibiotics.
Okay, thanks.
So this is in the lower, let's say, in the end of the middle of his talk. He told her that you need to ask doctors. So this is the only thing that he asked his colleague about. Okay, so always concentrate who is, if there is a female and a male, what does he want his colleague to do? So I'm waiting the answer from the male, okay, what does the senior is telling his colleague? So you have to know this, okay? What is the senior is telling the trainee? You have to know who is the trainee and who is the senior from their talk. So you have to concentrate on that. This is very important. So the answer, if your answer is C, then that is great. So I will see you to practice more on each part, on each subtest, and each part, especially part B, in the live online session. So I hope that you all get the mark that you want. See you in part C.